everyone, and welcome to Softfil Academy's webinar. I'm Hannah Tebeka-Azriel, and I'm very happy to welcome all of you. I will introduce this webinar slowly and just waiting for everyone to connect. But first of all, I would like to welcome warmly our expert and friend, Dr. Noury Adel. Thank you for being with us tonight.
Thank you, Hannah, for inviting me. Always a pleasure to be here.
So I wanted to just let you know that this webinar is going to start with the presentation of Dr. Noury Adel, and we will just keep the questions for the end of the webinar. Don't hesitate to ask during the presentation all of your questions in the chat or in the Q&R, and we will answer everything at the end of the webinar. Also, this webinar is being recorded and it will be available from tomorrow on Softfil Academy's website and on our YouTube page. The webinar will also be subtitled from tomorrow in French and Spanish. Could you maybe move to the next slide?
And you should consider adding Arabic language to the subtitles, by the way.
It's true. It's true. You know what? Maybe for yours, I will ask Soraya to do subtitles in Arabic because
I'm sending lots of love to the whole Softfil team at Prelinium, and especially for Soraya and Adriana because they do have an Arabic roots.
So I'm sure a lot of you are familiar with Dr. Noury Adel. I just wanted to quickly tell you a bit more about him. He is an oral and maxillofacial surgeon with 11 years of experience in non-surgical aesthetics. He is a leading aesthetic injector in Egypt, and he's also a speaker and a trainer for various training programs, conferences, and webinars. He's been a Softfil Academy expert for 2 years now, and he's also known for his contribution to scientific research and his publications in local and international journals. He's always publishing something. I think he never sleeps, to tell you the truth. A lot of you may know him for his creation of the 3.6 technique that was the object of a first webinar last year with Dr. Noury Adel. So if you're curious, you can check it out on Softfil Academy's website. And today he will present his chin technique. So I will now give you the floor, Dr. Adel, and thank you so much again for sharing your technique and your insights with us tonight.
The pleasure is all mine, and I would like to thank you again, Hannah, for inviting me. And I'm going to speak about my 3-point chin filler technique using the cannula. And luckily, it's going to be published at the PRS Global Open. It should be visible, I guess, by next month. So first of all, when we first started doing facial aesthetics, they taught us the rule of third and the rule of fifth when it comes to the ideal facial proportions. And as you can see, whenever you have a retruded chin or any disharmony between the maxilla and the mandible, you can easily spot it in the patients. That is why it's very important to understand how much a chin can have an impact or an effect on the overall facial proportions. And as they all taught us when we first started in facial aesthetics, you should always adjust your chin in proportions with the lips and the nose. And for me, first tone is the best analysis because the subnasal is always a fixed point. But what we commonly do in our clinic is the E line, the rickets line. But again, I will stick to the first tone analysis. As you can see, it's very important to understand that we should always adjust and harmonize everything with each other regarding the subunits of the face, because now we are starting to see those weird trends like the witch chin. And I call those procedures the Halloween procedures because our aim is to beautify our patients. It's not our aim to do any disfigurement to our patients. Moreover, there are starting to appear a very weird trends in the lips, like the Luran strips lips or the butterfly lips, and they do lip tapping. They even dissolve the old filler and they would re-inject another filler at the same session after dissolving, and they would place those plastic tape to tape the lips. And they actually call it the Michelangelo. I'm sure that the guy have nothing to do with this. He is resting in his grave. So it's very important to understand that the social media does have an impact. I'm not very fond of those techniques. I think this is totally against our role and our objective as aesthetic providers. And nowadays, I'm starting to do different techniques regarding the lips. I'm not heading toward volumization for some patients who have an acceptable lip proportions. I'm starting to think about the using of non-cross-linked hyaluronic acid for the lips, which is a purely hyaluronic acid skin booster. Remember, this treatment is not gonna give any volume. It is just aims for removing the wrinkles and the fissure in the lips at the picture that you can see. And this is one of the researches that I published about the use of hyaluronic acid skin booster for the lips. It's a purely therapeutic approach. As you can see, the fissures and cracks have been eliminated, and the lip does have a better texture at the picture in the bottom. Remember, no volumization. It is just a purely therapeutic treatment. You can use Revan as pure if you are going to speak about the range of fillers that we do have like today, or any non-cross-linked hyaluronic acid skin booster. Moreover, I'm also starting to investigate the use of polynucleotide in the lips, again, as a skin booster to provide hydration. They are not going to give any volume. It's not for augmentation. In this patient, I injected a polynucleotide, which is the Rajuran, if we are allowed to mention brands. In the lips, it is aiming for hydration. It's not going to give any volume. And in this patient, I did a 4-point technique. So basically, I did an entry point here, and an entry point here, and one here at this lower lip tubercle, and one on the other side. Then I started advancing my cannula to inject the polynucleotide in the lips. So 4 points of entry to do a cannula technique. I ruined my lips actually, so anyway. So this is the 4-point technique for the lips. It's a cannula technique, and I place a micro aliquot in each lip tubercle, aiming for hydration. But again, today I'm not gonna speak about lips. We are gonna speak about chin filler. It's well known that most of us use needles for the chin, but really you should think about this because there is always a possibility of doing a vascular occlusion for the chin, or worse, to have a tongue occlusion. And it's very important to understand that the use of ultrasound, experience, the knowledge about anatomy is very important to avoid those complications. And you know what? There is always anatomical variation, so it can be easily happen to anyone. I know it's a quite bit rare, but you should understand that there's a possibility of having a tongue VO, especially that you do have a connection with the sublingual and the mental arteries, and sometimes you do have a median lingual foramen here, median or midline lingual canal, where you could have easily a vascular occlusion with the injections at the midline of the chin, because they taught us